Hey everyone, I'm Dr. Shayna Powell, owner of West Elks Wellness and naturopathic doctor here in Montrose, Colorado. Today I have a very special guest who's a good friend of mine, and he is a certified breathwork coach, and I'll let him introduce himself here in a moment. But we're going to be talking about all things related to breathwork. We're going to talk about proper breathing 101. I know it sounds crazy, we all breathe all the time, but there's a lot of moving components to it for us to actually bring our awareness to. We're going to talk about different types of breathwork and how do you know which one to start with? How do you know where to start dabbling? And then different conditions that breathwork can be very, very helpful with. Things that are pretty obvious to anybody that's done a deep dive into breathwork are things like COPD, like chronic emphysema or chronic bronchitis and emphysema. Asthma is huge, sleep apnea, low back pain, and of course, one of my favorite things to talk about are hiatal hernias. So I will let Derek Udy introduce himself.
Hi, I'm Derek Udy. I am a certified breath coach in a few different modalities. I'm currently running Blue Raven Wellness, integrative wholeness, and I love talking about anything breathwork and all the things that it can do for us.
Mm-hmm. Yep. So I will, in the show notes, I will put this handout. It's called Components of Functional Breathing. I'll put like a little Amazon S3 link. So you guys, if you want the PDF, you can. But this is what I'm going to talk about as far as like the basics of breath work and all. Derek, you can jump in as we kind of go along here. And as I alluded to, functional breathing is not that simple. Because we breathe 24,000 breaths on average a day. Mm-hmm. And the question I always like to ask people is, how many of them do we have awareness around?
Well, right, and how much air are we moving with each of those breaths, because that's hugely important too.
It is. And I always like to do the example, I talk about the Hey Arnold character. I forget his name, I should have looked him up for this. Did you watch Hey Arnold when you were growing up?
Only bits and pieces, more like when my kids
Your kids were watching up, okay. So there's a character on there who always has terrible allergies and his chin is underdeveloped because he's...
Yeah.
So that mouth breathing is going to bring you in way more air than if you're breathing in through your nose.
Well, right, and not to mention it's not filtering into the air.
Nope.
And it's going to dehydrate you that much faster.
It's dehydrating. So the nose does a lot of things. We used to think of the nose as what? An ancillary organ, kind of like our appendix, kind of like our gallbladder. It's nice to have, but we don't really need it. And that's just frankly wrong. I don't think God makes that kind of mistake.
No, it's incredibly wrong. Like if you see an animal breathing through its mouth outside of a dog who's cooling itself, it's sick.
Yeah.
I mean, it's just sick.
Genuinely.
I mean, ask any rancher, ask anybody who's got cats or any other animals running around. Like if they're mouth breathing, they're sick. So I mean, that's
There's
what's going on.
four things that a nose does. It regulates the amount of air that we intake. It filters the air. We have these great things called nasal turbinates. And I made this statement when I was speaking with Dr. Jail. Please God, do not remove them. See an alternative healthcare practitioner before you remove them because it will cause you a world of harm, more than benefit. So filters the air. It also warms or cools the air depending on the temperature of the air, and moisturizes the air.
Yeah.
Those are all four things that we really, really need and are very important. And conditions such as like asthma and other forms of COPD are often overbreathing.
Yeah, absolutely. It's controlled hyperventilation, or uncontrolled or unconscious hyperventilating.
Unconscious hyperventilating.
Like where people are breathing in their upper chest, which is easier to do from your mouth, but way more difficult to do through the nose.
Yeah.
And the other thing that nose does is it's where nasal nitric oxide is produced. So without our noses, we wouldn't have any of that onboard laughing gas that we get in our noses.
Right.
So when you go to the dentist and they give you nitrous oxide, it converts in the body to nitrous oxide. And so we have onboard laughing gas just right here in our noses.
Yeah.
So.
So breath work. So these people, what are the drugs the partiers like to do?
Oh, whippets.
Whippets, yeah.
Yeah.
Okay, whippets, I don't know about that. But but if a person were to breathe, then could you get the same purported benefits then that you get when you do whippets?
Well,
seems like yes.
Nitric oxide, amongst being antimicrobial and antiviral, which is, it reports her showing that it does help kill the SARS COVID virus, especially early on stages when people are getting it. So it's antimicrobial, antifungal, antibacterial, and antimicrobial as one of the things. But it's also considered a spirit molecule. And so when people are utilizing their nose breathing and or increasing it nasal nitric oxide production by humming, like you're getting all those benefits, but it's also key in neurotransmitters. So like when people take psychedelics and like different hemispheres of the brain are all firing, nitric oxide is a molecule that also does that. And so indigenous people in Australia who are using didgeridoo, that's one of the ways they would go into that sleep time state, is by basically like getting a high on nitrous oxide.
Because it's relaxing.
Yeah.
So it's so interesting because
oxide.
it's like, it's relaxing to the primary cardiovascular system, so our arteries and veins, but to our erectile tissue in our genitals and our nose, it is congesting. It is vasoconstricting, so it increases the blood flow to those areas but prevents it from leaving.
Right.
So I often will tell my patients when I'm teaching them a little bit about functional breathing, hey, do you want to have better orgasms? Because if you do, you really need to think about the benefits of breathing in and out through your nose.
Right. Yeah. Well, there were studies that showed that once people who were having, for men and women, that were having arousal or erectile issues, that once they had started a good practice of nasal breathing, a lot of those issues started to subside, or they had better control over those things.
Yeah,
and so,
absolutely.
Sex sells.
Sex sells. I mean,
hence
Viagra. Exactly.
Right? Like sex sells. And
right.
So the key component of Viagra, nitric oxide.
Yep.
So
that's what it stimulates. Exactly. Okay, so the nose does, well, we'll say 5 things because nitric oxide production. The other aspects that we have to take into consideration of functional breathing is what's your posture. Because if you're sitting, and don't get me wrong, I'm not miss good posture 24/7. Like, I get lazy too, but that's why I have all these weird chairs in my office and my office at work too. It's like, if you're sitting like this, it makes it really difficult to take a good deep inhalation and get that diaphragm, this really big muscle that's right along the, kind of separates your chest and your belly.
Yeah.
Makes it really difficult for that muscle to do its job.
Yeah, that's one of the things that we do in my functional breathing classes at the Yoga Tree, is that we get people practicing utilizing the diaphragm and waking it back up in people, and putting your hands on your lateral side ribs and clenching your rectus abdominis, your front abs, will allow that diaphragm to start putting a load on it. And I've found that most people who can't or have a difficult time breathing down into their lower belly, which is where a deep breath is supposed to go, really struggle with that. And it's like, okay, first, now we need to start with some diaphragm exercises, which are, we can go over later.
Yeah, and I've got a couple in my handout that I will often do to people, or have people to start, because most people can feel the central tendon of the diaphragm, but it's more difficult and more beneficial to start feeling the lateral aspects of the diaphragm.
And it's training
the bigger muscle.
Yeah, I mean, that's what those are there for. Like serratus anterior, it's this huge muscle. Latissimus dorsi is in on that. And then you've got your obliques on the sides. And I mean, you can see them develop in someone who's doing a lot of functional breathing, just opening it up and closing it. And I mean, your breathing becomes so much easier that way.
It does. Well, and there's so many conditions that people have, like winged scapula, scoliosis, low back pain, that all can be remedied. And hiatal hernia, this is one of my soapboxes I will die on for the rest of my life. Like, if you are not breathing properly, you are not properly using your diaphragm, you are at risk for developing a damn hiatal hernia. The conventional medicine says, this is what they say: you are a large-bodied individual, you smoke cigarettes, or you were previously pregnant. Those are the 3 causes. Literally, pregnancy is the only one of those causes I see that causes consistently hiatal hernia risk. The number 1 cause I see is nervous system dysfunction from improper breathing. Typically, those folks are a little more anxious, so then they're doing what? Functional hyperventilating.
Yeah, just like upper chest, like big deep breaths, off-gassing all their CO2, brain stops working properly, probably leading into mouth breathing. Yep.
Well, it's like the pressure difference between our chest and our belly is different. So that's what causes that stomach to slip right up into the esophagus, is the fact that now we've changed the pressure differential that's supposed to be here, and more pressure, because we're breathing so quickly, and we don't, yes, we can get in the nitty-gritty of actually the gas exchange of CO2 and oxygen, which I do think is important for people to understand, because I don't think people really get why we need CO2.
Yeah, there's a lot of argument currently going on right now that CO2 is more important than oxygen. I mean, life on this planet developed in the absence of oxygen.
What's the air made out of? Mostly not oxygen. Actually, it's nitrogen.
Yeah. So, and we don't actually breathe in much CO2 at all, but we make it in our body. Every cell of the body makes it, and it's the number 1
so
hormone
we can feed our plants
in the body.
Right.
Yeah.
Oh, I haven't thought of it as a hormone before. I do think of it as an anxiolytic, so anti-anxiety.
Oh, 100%. Because it's a vasodilator. And a bronchial dilator, in fact, too.
Right. So this is what asthma medication does, is it's forceful using steroids to bronchodilate. And I'm not saying that that's right or wrong, just saying I want the listeners to understand that like there are things that we can do naturally that are very, very beneficial for us that can be paired in conjunction with things like steroids. But I have seen people not need their asthma medication anymore.
There's actually a lot of case studies. Patrick Mckeown from Oxygen Advantage and Konstantin Buteyko from the who founded the Buteyko methodology to functional breathing, which is one of the styles that I teach. Treat people specifically with asthma. And even when I go hiking, like because of all my years of smoking cigarettes, and then now since I've quit for a long time, I get exercise-induced asthma. Like, I mean, I live at high elevation. You know, I live in Crawford at almost 7,000 feet. But when I go to like, if I go on a hike, like I had to catch myself, and like I was like, "What's going on? Like, I can't catch a breath. I don't know what I'm doing." It's like, "Yo, bro, like one, you stop breathing through your nose."
Yeah.
I immediately shut my mouth. And then I realized like I was upper chest breathing. And as soon as I slowed my breath down and brought it down into my belly with my diaphragm, I walked a little slower. My nose ran a little bit, but that's a detoxification thing and it's gonna run. But it stayed open as long as I kept breathing through it. And the person I was with, way more experienced hiker, just huffing and puffing up the hill, mouth wide open. And I was just like, you can't catch your breath. Like, no, my nose is running too much. And I was like, I'm dripping over here. Like, take a handkerchief with you, folks. Like, yeah, like that's what handkerchiefs are for. Do that, and eventually that will stop. Like that condition will go away, and you'll just be able to breathe in and out your nose easily. But having to slow down and take those deep, long, slow breaths into the belly and then out, like it made all the difference with that happening. But I was going into anxiety. I was going to panic, like, you're the breathing guy. Like, what's going on here? You're so out of shape. I was like, no, I'm not out of shape. I wasn't breathing right. And as soon as I did, I was like, oh. And I calmed down and I was able to do that. So
I'm really curious the relationship between panic attacks and anxiety, because both of them in my mind are CO2 deficient.
Oh, I would agree with you 100%. And there's work being done with the Oxygen Advantage people where they're actually saying, or coming out with studies saying that anxiety and panic aren't mental issues as much as they are breathing issues.
I fully agree with you.
I've been trying to teach people some breathing techniques for that. When you don't have a paper bag around, you can just put your hands over your mouth and breathe as slow as you can in and out. Because that nitric oxide is also going to be produced and start pooling in the nasal passageways as you're breathing in and out, which is also very calming to the system and just calming people's anxiety down.
On top of that, bringing the awareness, the mindfulness of like the breath, which is such an important thing for people dealing with anxiety. And I can speak to this as someone that once was having panic attacks on a daily basis. Asthma, panic attacks, anxiety, all the fun things.
Hand in hand.
Right? All not breathing functionally and like super stressed, dysfunctional breathing. And really working on these systems made a big, big difference in my life. I'm very grateful for these experiences. So posture we talked about. We're kind of just jumping around through the nose.
Real quick with posture, like I mean, so you've got your diaphragm, right, and it's kind of that umbrella-shaped thing you're saying. But down in the pelvic girdle, there's also another diaphragm in the sense that it holds everything together at the bottom. Those two are linked. And so if you've got anterior or posterior tilt, you're going to throw off your upper diaphragm as well. And so strengthening that upper diaphragm, which is one of the things that we focus on with functional breath work, is strengthening that diaphragm. And then that muscle is huge for moving lymph. Some consider it the second heart. But also, because of where it attaches to the ribs and the spine, it's going to help adjust your lower pelvic tilt
and stabilize it.
Totally. And then you've got everything going. Constipation starts to go away because you're breathing, moving that around. There's even things about cholesterol and
then
the
you're
liver.
not tense. Like, and I would argue there's a third diaphragm, and that's your throat, your vocal cords, which looks strikingly similar to your pelvic floor, with the openings and whatnot. It's very curious to me, and I mean, it's a little bit different than the way the diaphragm looks, but the diaphragm has a hole centrally as well for the esophagus to drop through.
Yeah, someone's got to get through it.
Yeah, and so we have these three diaphragms, and we were talking just before we started. It's like I was dealing with TMJ dysfunction, and we were talking about tongue posture and how that plays a really big role. And social media loves to be like, oh, it's all parasites. No, I mean, maybe. I'm not going to say no, but like probably not. That's not the first thing I jump to. I want to know functionally what's going on, because I think our society is just so dysfunctional in so many ways. Like the binkies we give our kids, that they're not shaped like a female nipple. They're shaped like this flat, like weird thing.
That flat tongue.
Right, and then we're ending up with like narrow palates that are really high up, and that causes. So I've got there's so much to talk about with this. I have a colleague who started doing palate extension, also an ND. she had a lot of health issues when she was a baby. She had like liver transplant and everything. She started doing palate extension. Her face looks different, one.
100%.
And two, she was like, the amount of anxiety that I have has gone down dramatically in the last year because she's able to breathe. Her airway has changed.
Yeah. Well, there were studies that doctors were doing in the early 1900s, and in the book section in James Nestor's book, Breath, he talks about the different studies that were being done on dogs and monkeys. And it was striking that within 2 months of constant mouth breathing, like the monkeys had developed the same problems as modern humans. Underdeveloped jaws. I mean, these were perfectly healthy animals that then were forced to breathe solely through their mouths and watching them deteriorate, and then doing that with dogs. Basically, that hyperventilation and mouth breathing is like slowly killing yourself. Because you're over, if you could over oxygenate, it's really you're under CO2ing yourself. But it changes everything. That pressure inside the body and the tongue pressure, like we were talking, like having the tongue at the roof of your mouth where it's docked, creates a certain amount of pressure that then, conjunction with nasal breathing, develops the jaw. I mean, our wisdom teeth, you think our ancestors went to the doctor to have wisdom teeth pulled out? Like, no shaman was pulling teeth. They all fit because their jaws were eating hard foods that they had to chew for a while, like God forbid, you got to work for your food. But then also they were breathing appropriately. And just, it seems so silly, but that amount of pressure in your skull and in your face helps to develop the bone structure and the design of your body.
Have you seen anything in your researching, digging into things, if focusing on breath work and increasing muscle stability, because we have a lot of really small muscles in here in our throat and mouth, affecting tinnitus?
Yeah, I mean, anytime you're affecting the jaw and developing that, like, I'm willing to bet that's with that. I'd have to do a little bit more research directly in that. That would make sense to me, though. Like, so yeah, I haven't done a deep dive either. Moving the jaw forward, right? It's
moving the jaw forward, so it's not pinching those really tiny muscles in there and like stressing that that nerve. But also, then, if the nervous system is working properly and your bones are developing appropriately, which can still change, even if we're an adult.
No, 100%. You can still regrow your face. That's the problem, right? Is we don't get saggier, we lose bone mass, and then our faces are sliding down our face.
Exactly,
so,
no, totally.
But you can always regrow that bone. And stem cells are down in there.
And how do we regrow bone? Muscle.
That's right.
We have to strengthen our muscles. It's like this whole thing of like aging, our muscle just degrades, and it's like, no, you're not using your muscles appropriately, including our face, including our tongue. Our tongue, pound for pound, like per like amount of muscle we have, is our strongest muscle in our body. Is it our tongue or our masseter?
I believe it's the masseter.
You might be right.
But
I think
the tongue
it's
is right there for like pounds of pressure.
Yep, for its like, capacity, for how small of a muscle it really is. Like, it's very capable. And you're spot on. Like, Weston A. Price's work. Are you familiar with him?
Oh yeah. Oh my God, the best
teeth,
dentist
they're
ever.
like perfect straight teeth in these people that had like literally algae on their mouth. They didn't brush their teeth.
Nope.
So what were they doing differently? They were eating appropriately for them. They weren't, we can get into like that. That's changing the pH of our mouth, but we'll save that for another one because I really want to make sure we talk about the breathing.
But chances are they were all nasal breathing. Ancient cultures, especially on this continent, would close their mouths. I can't remember the book, Just Shut Your Mouth. I can't remember his name. Wrote it in the 1800s. He went around and painted and documented all the native cultures that are now extinct, a lot of them, including like the Mandan and the Plains Indians. And they would go around and the mothers would close the mouth of the infant while they're sleeping after they had breastfed. Like, you can just see it when you walk. Just close the mouth. Pinch. And they were all all believed that breathing through the mouth was like akin to killing. To killing.
It would be really interesting. So the monkeys and the dogs, did they talk anything about their body shape changing with mouth breathing?
No, it was mainly their face and then all the conditions that went along with that. But as soon as they, the ones who survived, as soon as they went back to nasal breathing, so did their facial structure.
Interesting.
And their the health defects that they had developed from mouth breathing also subsided. And James Nestor talks about that in the book as well. So it's definitely an enjoyable read, an entertaining read, and it was incredibly enlightening on my journey, as you know, because you lent it to me, back in the day, and that's what started
and it's
this
like a
whole
super
thing.
Accessible book. Like, you don't have to have some fancy degree. Like, it was a New York Times bestseller. Like, really easy to read book, and like kind of gives you a little dabble into the different types of breath work without like, deep diving into anything too much. It's like, the Buteyko method. I'm really curious about that because wasn't that It's been a while since I've read the book, but wasn't that the monk that was like in a cold area and he was like breathing for a long time?
He was in Siberia, and he was a Russian scientist in Siberia who actually chose to go work in deep Siberia so he could work alone. He came across himself one day working in the asthma ward or in the dying ward, I can't remember which, in the hospital, and he saw his own reflection in the window while he's standing outside the storm, and it occurred to him while he's standing there, and he had hypertension, like extreme hypertension, was basically working himself to death, and he kind of thought to himself, like, is my hypertension dictating my breathing, or is my breathing dictating my hypertension? So he started developing techniques for breath work, and that's where a lot of the functional breath work stuff has come from, and started treating the patients. Got the government, the communist government, to send him to Siberia so he could continue his work. And then once the wall fell, he opened it up. And so he cured himself of hypertension and all the health risks that went along with hypertension by changing his breath.
Yeah, I have a great story about this from when I was a student working with Dr. Brad Lichtenstein at Bastyr at the clinic. Dr. Brad was, I'll just give him a shout out because he was my biofeedback teacher. He's the one that introduced me to breathwork. He, in short, changed my life in the introduction to this work because it's like simple, can be very profound. There was a gentleman I worked with, very like stressful, lots of employees, 3 medications, uncontrolled high blood pressure. Like we're talking crazy, like 210/110, which is very high.
Like
and he was fine.
Rupture.
No symptoms, no like end organ damage, like no changes in vision, no ringing in the ears, couldn't feel. He was just, he had a very stressful job. We got him breathing. The requirement at the Bastyr clinic when there was a biofeedback shift was you come for 8 weeks, once a week. You work with the same clinician. So he was working with me and one other student, and within, it was like maybe by the 4th or 5th one, he was starting, we could see his blood pressure in office go down.
Oh, yeah.
And so this is a person that is what would be referred to as medication resistant in the conventional world. And because his problem wasn't that he was deficient in an ACE inhibitor medication or an ARB medication or a calcium channel blocker. These are medications we use to control, or manage, I'll say, high blood pressure, hypertension. We got him breathing and he was able to like unwind a little bit. And this is really the issue. And like you could see like his tension in his forehead kind of like melt.
Yeah.
And it was like a little intimidating for me because like this is a really powerful man who's sitting here, who's trying to help me as a student learn. So like very profound person for me to see his numbers come down and be the lowest I had seen. I don't remember what they were, but like again, 210/110 is like high emergency room. You're going to die.
Yeah. Like get in there before you stroke out.
Exactly. That's bad. I have patients that come in with 160/75 or 80 and they're like, oh, my blood pressure's too high. Like I'm not feeling good. And it's like, he just got used to functioning like that and having his blood pressure just like beating his symptoms. But the point of this is breath work can be very profound for serious conditions that we are told that, the only solution is your medication. And, that's what I really don't like about the conventional system is the only solution is pills and surgery.
Right.
And that's great from their perspective. And to then poo-poo those of us that are doing quote unquote alternative or complementary, which I really hate that term. These things, we go together. It's like, you're not treating this with the medication. He's a perfect shoe-in for working with us. So he doesn't need to be taking medication, which does have adverse symptoms.
Right. Well, then you're taking a bunch of other things.
Yeah.
And I would like to see a pill work as fast as breath work.
Amen
I mean,
to that.
I'm just saying, like, when we come onto this world and incarnate, the first thing we do is take a breath.
True.
And the last thing we do is take a breath or exhale that breath. And so it's like, pills and surgeries, like they're very, immediate and they can be very beneficial, especially like in
100%.
life-saving situation, you're bleeding out. You need
wartime
breathe
medicine.
all you want, like whatever.
Right.
But for all the other things going on throughout, especially in modern life, I mean, just looking at the way people are moving about and the acidity in the food, just in the way that the deterioration of all that, which is a whole nother thing. Like, it's like these are the tools that we have, and they're the ones that have been lasting. I mean, there's the earliest documentation of any health record anywhere. It's talking about breath in the Indus Valley. So it's like, it's the first yoga. It was the first thing everybody was doing. I mean, all the way back to ancient China and Japan, like everybody was talking about that. So it's like they didn't have pills. We don't have this luxury of taking a thing of
Well, and
modern
really,
medicine.
the United States is one of the only countries that has that luxury.
Right.
Like, medications are very, very expensive, and that's one thing I don't think most Americans understand, because so many of us have insurance, and like, oh, my insurance that I pay $2,500 a month for covers my medication. It's like, okay, well, in countries where medication's not accessible, what do people use?
Right.
They use herbs and they use breath work. They use the traditional ways of moving through the world, traditional medicines. And what I love about breath, it's free.
Yeah.
You just have to remember. The funny thing is like, remember to use it.
Yeah.
That's always the hard part. But if you can take that moment and pause, feel your feet on the ground when you're having that moment of, I'm about to have like you did when you were hiking, like, I'm about to have a panic attack, I'm freaking out. Can you feel your feet? Can you take a breath that is a diaphragmatic breath, so you're feeling it in your side body, not up here in your chest body, because that's going to make you have more anxiety. And really feel that diaphragm expand and flatten as your lungs fill up. And your lungs, people don't realize this, but when I learned for physical exam that you can hear lungs all the way up here by the clavicle, and like up here is where we listen to the first point on the back. Wow. I was like, what? But it's true. The lungs are a very large organ in full expansion.
Yeah. Oh, they're huge. And I mean, what's funny is, when you're breathing down in the lower lobes of the lung where breath is, it's all parasympathetic nerve endings. And it's you can absorb twice as much oxygen by getting it down that way than you can up top. And you're only dealing with the sympathetic nervous system in the upper lobes of the lung. So again, that's where you're going to get your anxiety and your panic and all those kind of issues going on, racing heart and racing mind. It's like the first thing we talk about with people at class is like, oh, you want to calm your mind? Great. Take an exhale, hold your breath and count to 5. And then breathe in through your nose. And then let's do it again. And just slow. We teach them to sip the air. Because, I mean, we were talking about food earlier, like an overconsumption of food is talked about a lot. And, people are like, oh, don't drink too much water, because you can basically wash out your electrolytes, but you can also basically drown yourself, as some people have done in places. But you can also over-consume air.
Definitely.
And so it's where the sign of less is more. You're sipping that air in. You can draw deep in slowly to the belly and immediately feel calm and connected.
Yeah.
And I teach people to count their breaths or count the seconds they're inhaling, because then the mind shuts off and you can't be worrying about it. Can't worry and count at the same time.
Right.
So anytime you're having a hard time, just start counting.
Right.
And your thoughts are like, what? I mean,
count backwards from 100 by 7.
Yeah, it sounds stupid, but it's like, just count, and your brain is like, what? Oh, I can't worry anymore. I'm busy. I'm counting.
Right.
So it's a great way to incorporate the two with that.
When you teach your students to sip the air, this was one of the things that was most interesting and most challenging for me, is breathing quietly. It should have no sound.
No, you should, like the person next to you in class shouldn't hear you. You shouldn't hear you either. And in fact, once you start drawing your attention to your breathing, like what we'll do is we'll have people put their finger under their nose, like, and you feel the warm air going in and out. All you should feel is the sensation of cool and warm. Like the objective is to practice to the point where you don't even feel yourself breathing, and then you're like, oh yeah, you're probably breathing for your metabolic needs. If you're doing CrossFit or running, like, you're going to hear yourself breathing. But if you're doing it functionally, you're going to be breathing in and out the nose and have more energy, more endurance, and last longer without lactic acid buildup, because you're going to be in an aerobic state instead of an anaerobic state. But yeah, I had to like reframe it for myself too when I was developing my practices as it's just like sipping it, like as if you were pulling it through coffee straws, and just like as quiet as possible. And I mean, it takes a minute. It takes some practice to be
God,
like,
when Dr. Brad was like, because I did the biofeedback shift with them when I was a first or second year student, I was like breathing with my throat.
Oh yeah, like Ujjayi breathing.
I wasn't trying to breathe that way intentionally. Right. Like, it was just me like trying to do it. He would call it efforting. You're efforting right now. You need to not effort, and you need to let your body do its job.
Yeah.
And
if you get out of its way, it'll do it.
Exactly. This is what I say. NDs do 3 things. Help the body, give the body what it needs, help the body take out the trash, and then get out the way. That's my brain, that's your brain.
Yeah.
We don't need to think all the time.
Yeah.
Let the body do its job. Just like get a feel for it, and then let it do it. That's what we're talking about here, is like sipping the air. I like that visual of sipping the air, because that helps it make it a little more attainable, rather than just breathe quietly. just breathe quietly.
Yeah,
I'm
like breathe
how
quietly.
the fuck do you breathe quietly?
You're gonna stress yourself out. It's like, holy shit! Like, how do I breathe quietly? It's like, well, I don't know,
I
but you're not doing
stress
it.
myself out
Like,
so much by that.
just like sip it. Like I guess the new one I've been using is like sip the air like you're elongating, smelling the most beautiful flower you've ever smelled.
Ooh, I like
it's just
that.
like, and then just let the exhale fall away. You don't even have to work on it. Like the lungs and the diaphragm will just and
They do it.
You know. But something else that people don't think about is getting all the air out at times.
Right.
And that's where it comes in with people with emphysema. It's like we can't cure the damage that's done yet, but what we can do is enlarge the ability of what's left to work more efficiently.
Yes, and I would say the same goes for asthma because it's
Yeah.
the same issue of like retained old CO2 that's
Yeah.
retained in the deeper parts of the lungs that just doesn't ever move.
Right, and it takes up space.
Yes.
It's really, I can't catch my breath. It's like, well, yeah, you can't pack in what's there. So one of the other practices that we do is we'll do like forced exhales, where you exhale as much as you can and then you start counting backwards from 10 and then you count out loud. So that way, I mean, it's the very few times do we breathe through our mouth, but there are times that we do exhale through our mouth with functional breath work.
Mm-hmm.
And that's one of the times where you can push it out. And so we just count backwards from 5 or from 10 until you just get it all out. And you can feel your abs just pushing that up and pushing, and that diaphragm is just pulling in, clearing out all that air. And then all you do is you let go, and your lungs will just go and fill up. It's the craziest sensation.
So
and then you just,
amazing.
You breathe normally for a few minutes, and then you do it again.
Yeah.
And it's amazing how much more breath you feel like you're getting.
So let me ask you this: so the lungs themselves, the lung tissue doesn't have any muscle, as we know, like muscle on our arms and legs, but it has something called the alveola. And the alveoli, what are like? There's the bigger clusters, and then there's the really small clusters that are alveoli.
And that's where the gas exchange happens.
That's exactly where the gas, and we're talking cellular here, people. Like we're really deep into the anatomy of the structure of the lung. So the tissue, though, that makes these little cells, is that kind of what we're like helping to strengthen when we're doing these intentional breathing exercises, or like what's your conceptualization there?
Really, what I focus on is the diaphragm.
The diaphragm.
Because it's going to be driving
that muscle.
the lungs.
You're right. You're totally right.
Is everything's in the diaphragm. Now, those alveoli sacs are going to pop. They're going to open and dilate with the gas exchange. I haven't delved that deep into the anatomy of that structure. It's just too deep for most people when I'm talking about it.
It is for sure. You're right, though. It is the diaphragm, though, and inherently by strengthening the diaphragm and properly getting all the old CO2 out, the body is able to do its job more efficiently.
Yeah.
So the lungs, they're not a detox organ in the way that a liver and kidneys are, but they are a detox organ in like a secondary, emunctory way.
Well, unless you're trying to lose weight, and then they are the biggest way to lose weight. People think that you lose weight, you burn fat with cardio, and that's just not true. When you start looking at the science of it, if you were to lose 10 pounds of adipose, you would lose 8 pounds of that through breathing it out, and the rest would be through
you were saying that it's like very metabolically
avenues.
like stimulating.
Yeah, so CO2 as it breathes out carries weight with it, literally. So people are like, oh, well, how do you stay so thin? You just eat whatever. It's like, well, I breathe better than you do.
Right.
I mean that's part of it. I mean,
it's part of it, but also there's the whole
there's exercise and there's health and there's various aspects of it.
The constitutions people have too.
Sure, there's a lot at play.
Yeah.
But the biggest thing that people can do if they want to be losing weight is learn to breathe better. Because if you're, it's like the way that the cell creates energy through ATP is you have aerobic with oxygen and anaerobic with sugar. And so it's like you're burning a fuel with wood, which is not as efficient as burning fuel with gas. Right. And so when you're breathing properly and you've got a better ratio of CO2 to oxygen exchange going on, right? With higher CO2, the available oxygen that's in your blood can get into the cells and swap out. Without that CO2, you can have all the oxygen. You can get up to 100% saturation, which is the fad right now, is to add oxygen.
Right.
You're not fucking doing anything for yourself.
I always thought that was weird to me. I was like, that doesn't make sense
give
knowing
more
breath
oxygen.
work.
Yeah, you can't. It doesn't matter how much oxygen you throw at someone. You're not going to do anything for them if there's not enough CO2.
Right.
Because the way that it detaches from basically from the hemoglobin, right, inside the red blood cell, it can carry 4 oxygen molecules. Well, those 4 oxygen molecules get swapped out with CO2 molecules. They like exchange places outside in the cell, outside of the mitochondria.
Yeah.
And so, but if your mitochondria aren't being used, they will die off. But that's where ATP is produced. That's where we burn off everything, is in the mitochondria. So, but they can reproduce themselves and get more mitochondria going on.
Right.
The argument being, the more better CO2 you're using, the better oxygen exchange you have going on inside the cell, the more mitochondria you need, the more they're functioning, the more energy you're burning, thereby
more energy you're making.
Well, yeah, exactly.
So when you started talking about mitochondria, and
yeah.
again, we're getting into like the weeds here, but for people that are nerdy, that's okay. Mitochondria, what we talk about in cell biology, is like the energy powerhouse of the body. And as soon as you said aerobic, which uses oxygen to like make the mitochondria go, you make, if I'm remembering correctly, 32 ATP versus, I can't remember if it's like 6 or 8.
Yeah, it's like 16 times
right
more
like
with
way
oxygen.
More
way
with
more.
oxygen.
Way
so
more.
that totally makes sense from a metabolic perspective, because when you said that, I was like, I don't know, like maybe, like I haven't done a deep dive, so I can't say for sure, but that makes sense. And I was sitting in a carbon monoxide like continuing education recently, and the guy's argument was, we're giving people 100% pure oxygen when we should be giving them more CO2. And he was saying the same thing, is like, we are harming people because we're flooding the system, not realizing that it's the fact that they have too much carbon monoxide bound, which binds more fiercely to our red blood cells, our hemoglobin, than oxygen or carbon dioxide does. So you have to flood the system and push to get that out of there. You have to have a surplus in order for it to happen. And he was getting really heady. Like it's rare that my brain is like, what is this person talking about? But you could tell, like, he spent a lot of time doing a deep dive on this. A lot of people die from carbon monoxide poisoning. Yeah. It's odorless. It's it doesn't have a taste to it. Like you wake up and you're dead.
Yeah,
like,
you just don't. Yeah,
right.
You're done.
Okay. God, this is so interesting. So metabolically more stimulating. So see, again, something that's free, and it can't be that good if it's free then. And like
that's what people think.
That's what people think. But my favorite thing is like the discharge, my patient that I discharged today, it's like, you're doing great. You're on the right track. You don't need to come back unless you need me. Yeah. That's my favorite thing to do in my job. And we did breath work with him, because he was seeing me for some digestive issues, and breathwork is one of the mainstays of treatment. It's the most effective. We can do all the sexy things, but breathwork is one of the foundations for health. And if you ain't breathing, you ain't living. No,
100%. I mean, I say all the time to people, like I really feel like that learning to breathe functionally, like our body's designed to, right? It's a mammal. It is designed that way to work within the confines of its structure. Yeah. And when we're doing that, it is the most important thing anyone can ever learn to do, is breathe properly. Everything else is secondary to that, because you can go 2 weeks without food. You can go, 2-3 days without water. But how many can go 2 minutes without air?
Right.
I mean, I'm just saying, like, it's
You're
like,
not
holy
wrong,
shit.
Dude.
Like,
breath used to be the first
right
of my foundations, but it's so hard for people to wrap their mind around. Things that are easier are like hydration, nutrition, sleep, and exercise. Yeah. And I put it down in connection, breath work in connection, because it's one of those things that it's so hard for people to be like, you're literally going to sit here and tell me that if I sit my ass down, I have good posture, and I feel my diaphragm, I'm going to feel better. Yeah. Yes, I'm going to tell you that. But it's so hard because we've been so conditioned that, well, I have my asthma and I have my anxiety, and my dad has asthma and my mom has anxiety. Like, it just runs in my family. There's nothing I can do about it. It's like the medical model that we have is so disempowering. Right. And when you start breathing, all this stuff just like wades away. And along my own health process, like, I had severe anxiety, as I've alluded to, right? And I had a mentor ask me, she's like, what would your life be like without anxiety? And, being in the psychiatrist world and being told that that's just what you're going to have forever. Yeah. I was like, I literally never thought about that. Like,
I just thought I was going to live with this forever. Like, this is just how I am.
I was like, that question was asked to me like 6 years ago, 8 years ago now at this point. And I still think about it. It was like one of those moments that was just like, it just hit me. And when she asked me that, I was like, oh my God, I don't have to be anxious.
That you don't have to be this way. It's like, oh, well, your parents are this way. It's like, yeah, well, so bad habits pass down through the bloodline. Great.
They weren't breathing. My mom smoked 2 packs of cigarettes a day.
Yeah. But I don't want that. There's actually, in some instances where cigarette smokers have better and are more relaxed. Because they're breathing. They're out there taking deep breaths. And some tobacco produces nitric oxide. You know, I mean, I'm not in any way toting the benefits of smoking, but a lot of people take up smoking so they can go outside and take some breaths.
You get more breaks.
Oh yeah, people are like, oh, go have your smoke break.
And then you get to socialize and you get to go breathe.
Yeah, but you're breathing in and you're breathing that long exhale. And I mean, by all means, people don't start smoking cigarettes.
Pros and cons. That's not what he's saying. But we talk about this. We've talked about this in my breathwork class too. It's like, is it the smoking the cigarette that's the benefit, or the fact that they get more breaks and they get to spend a pause of moment of breathing?
Yeah.
Which just happens to be with a tobacco product.
Yeah, or with cannabis smokers too.
Right.
Like anybody who's
out
there vaping, it's those long exhales that are relaxing you. Like it's just short inhale, long exhale, keeps you in that parasympathetic state. I mean, all those other, like nicotine is a stimulant, right? It's not relaxing you. No. You're just treating the cause of smoking. But those long exhales, wow, powerful.
Yep. So let's talk about different types of breath work. And we've talked about a couple of them. Really the main, so I know pranayama from yoga. Paced breathing is my main modality that I use with my patients. The Buteyko method's really curious to me. And then who's the guy? Who's the guy?
Oh, you're talking about Wim Hof?
Wim Hof.
Okay, so Buteyko method and Wim Hof are like worlds apart.
Yeah.
I mean, they're like the complete opposite.
Okay.
And so and when I got into breath work, like originally it was like I saw something about Wim Hof. Like he's out there, he's doing amazing things. Mm-hmm. There's a lot to be said at times about his techniques, which are basically like, I mean, he didn't come up with these techniques. He pieced together a lot of things like most of us do,
Sure.
And he's done it well.
Mm-hmm.
So there's not a diss in any way on the methods, but it's really, that's a lot of hyperventilation.
Yeah.
And so it may work great in the short time, but in your long run, what you really want to be focusing is that quality of breath with every breath. Mm-hmm. And so that's where the Buteyko method comes into play, and even just like in resonance breathing or pace breathing, right? That goes right into Buteyko method as well. It's that 5.5 inhale, 5.5 exhale with 5.5 liters and 5.5 breaths per minute. Yeah. It's just like calming down. I mean, the average person is breathing 14 to 18 breaths per minute.
Which is considered normal, but it's actually hyperventilation from a functional breathing perspective.
Yeah, that's chronic hyperventilation, which is leading to all the other health negativities with that. So with like Buteyko method, I mean, so you have your controlled hyperventilation, and there's a lot of great body work and breath work out there. That's one of the first styles that I got certified in. Mm-hmm. And it's basically utilizing holotrophic breath work that was developed by Stanislav Grof when LSD became illegal. And basically what you're doing is you're hyperventilating, you're taking a 2-part breath, usually all through the mouth, in and out the mouth, and it's like, so 1 to the belly, 80% breath to the belly, 80% breath to the chest, and then a relaxed exhale, and then just doing it, just huffing and puffing, and you'll develop tetanus, or not tinnitus, excuse me, tetanus, or tetany and things like that go away once you've re-regulated your CO2 levels. So what you're doing when you do that is you're off-gassing your CO2, which allows you to hold your breath for a longer period of time, because the trigger to breathe isn't lack of oxygen, it's increased levels of CO2. And so and then you come into the other side of the paradigm, which is what I work on with functional breath work, and where I really believe the meat and potatoes of breath work is in those mini breath holds on the exhale, breathing all through the nose, in and out, daytime, nighttime, sleeping, exercising.
As much as possible with exercise.
As much as possible. I mean, there are the best shaped human beings who are living in native tribes across the world who are still practicing their ancient techniques. They don't mouth breathe. So CrossFit, like, great. You can still work your way up to nasal breathing through CrossFit. Some of the most extreme athletes, out there winning things are doing it all through the nose. So it can be done. It just takes some practice.
Swimmers.
So the Buteyko method, and what we work with within the Oxygen Advantage system, which is the second certification I went for, it's about mini breath holds. It's about building your CO2 tolerance and getting used to that, so that basically what's happened over time and in modern life is that we've oversensitized ourselves to CO2. And so when you hold your breath and you feel that urge to breathe, that's your chemoreceptors in your brain saying, hey, you need to breathe. And you'll feel a twitch in the diaphragm or swallow a few times, and then you breathe it in.
Yeah, and chemoreceptors are like chemical receptors that say, oh, we're sensing oxygen or CO2. We need something to shift here.
Yeah, exactly. And so they have a straight line to the diaphragm that just fires right to it and says, breathe, or what's going on down there. And so what we work on is not overstressing the body, which is what hyperventilation is going to do, is overstress your body. It basically, holotropic breath work and hyperventilation trips. It overloads the sympathetic nervous system and basically causes it to trip, and that's where you start getting into various things going on with the chemistry of the brain and things like that that the listeners can get into with the books and things like that.
Sure.
And with Buteyko method and oxygen advantage methods, it's the opposite. Is what we're doing is we're trying to slow the system down.
Yeah.
We're keeping people in the parasympathetic system longer, which is where the monks and the daily meditators. It's where people are living that are calm and chill and living super long lives. I mean, there are other factors, diet and where you live and all those things.
Yeah. Lots of socioeconomic components. Yeah.
Absolutely. But if you want to make yourself calm and you want to be able to chill out in traffic or just have a decent time at home, like using these methods of slowing yourself down, I mean, that's the only way we gain control over the autonomic nervous system as a whole is through our breath, because it's the only thing we can control. But you can control heart rate, you can control your breathing, you can control your mind in that
sweat
way.
Response.
Yeah, just general overall well-being just by slowing the system down.
Right.
And then that becomes the issue of less is more with the oxygen advantage style techniques. It's all about less is more, like breathing in to what you need for the metabolic rate of what's going on.
Right.
So when we're just sitting, we're just consciously breathing slowly in and out for what we need. Racing around, you're breathing just what you need and not more. So those are the main different types. I mean, there's a lot of fads right now. Not fads. There's a lot of emphasis put on holotropic breath work and controlled hyperventilation. Right. And for most people, it's probably fine. Like, I mean, I guided you on some journeys. I like using those journeys in situations. A good friend of mine who had gotten himself off of meth, normal daily breath work wasn't going to work for him where he was at. It just made him more paranoid. Right. But once he tripped that system and overloaded the system with that controlled hyperventilation, like that's what broke him initially of those habits of the way he was acting, because he was living in that sympathetic nervous system all the time. He was just amped up. So for people who are amped up, who don't have any of the, some serious heart issues or health problems, because they can be exacerbated, or schizophrenia, used in moderation with a clinician would probably be best. You can do some of those techniques, and they do work for a lot of awesome mental issues in conjunction with therapies and things like that. They can be very profound.
So your friend that helped himself get off meth, he used more of the hyperventilating ones.
Yeah, because he was already tripping his sympathetic nervous system.
So relaxing was too triggering for him.
Yeah, there was no way he was going to be able to do that. Now what I work with him is developing, now that he's not living in that fight or flight all the time. Yeah. Now we're working on, okay, now let's get used to being calm. Now let's work on your daily practice. That didn't feel safe.
So there's a type of, I wouldn't necessarily say it's breath work, but a mindfulness exercise called, what is it called? It starts with an A. I'm forgetting, but it was the same thing. It's as again, someone that ran on high all the time, stress chemicals, myself, autogenics, that's what it's called. And it's where you go through and you're my hand is heavy, my hand is heavy, my hand is warm, and you just do this through different body parts. And he's there's always one person in the class that freaks out from doing that. I was that person. Wow. Because I felt so relaxed. I was this isn't safe. And I immediately jumped up. My heart rate was through the roof. I was nope. Yep. And now I can do things that are more relaxing. I mean, this was years ago. I was also in school, 16-hour days, all these components that were adding to the stress bucket.
in that state.
Yes. Yeah. Exactly.
Yeah.
I was high functioning.
In that way.
Yeah, not a good way. I don't recommend that. That is why I live in the country and why I moved from Seattle to a place that didn't even have electricity. Yeah, because I needed a break from living that life. That is not healthy at all. And it'd be really interesting if people did kind of take breaks from the city more frequently than they did. But, interestingly enough, psychiatric issues are much more common and more severe in the cities.
Oh, of course they are.
It's noisier, it's crowded. It smells bad.
Everybody's moving around.
Yep,
like,
exactly.
Just
you can
like
kind of
chasing
feel
each
that
other
kind of
down.
like energy.
Yeah.
You know, it's like 3 a.m. in Montrose. What's going on? Nothing.
Yeah.
Typically nothing. It's like, so 3 a.m. in the city, people are getting home from the bars.
Oh, sure. Or they're going to work.
Or they're going to work. Yeah, that's true. I mean, some people are going to work here too, but it's still like, there's still that like quietness, the quaintness of living in the country. It's a little bit different. So interesting. Yeah, and I tend to not be a fan of Wim Hof, but you just kind of like helped me understand where the benefit of doing hyperventilation therapy is.
Well, and
too many people are running.
They're already in that
They're
system.
already there.
Yeah, so I mean, it can be useful.
Right.
There can be long-term health effects from just even doing months of controlled hyperventilation.
Sure.
Different people have talked about different things. There's plenty of research out there on that, where people have developed heart issues because of doing those things.
Whoa.
Of doing long, strong breath holds and things like that. I mean,
So predispositions, like really knowing these things could be really beneficial.
Yeah.
The thing that I don't like to like be like, oh, that's bad. Because here's what it does for people. Oh, I got introduced to Wim Hof. I'm curious, are there other types of breath work?
Right.
And then you kind of like start to stem out when you like, so nothing is inherently bad. Everything has a purpose and a place. It's just picking the breath work that's most appropriate for you and your needs. And this is why working with a coach or a trained clinician that has an experience with breath work that can be very, very valuable for a person.
Yeah.
And I like paced breathing, or what you've referred to as resonance breathing. Is the same thing. It helps to increase heart rate variability. That's a safe one to start with because most people are breathing, as you said, 14 to 18 breaths a minute.
Yeah.
And we should be breathing between 4 and 6 breaths, depending on the person, a minute.
Yeah.
That is a normal functional breathing rate.
Right.
Which is crazy for people.
Down to 6 liters of air per minute as well. And so there's another component to that, but all the same, slowing that and getting that pace where the heart and the heart, breath, and mind, but mainly it's like your breathing and your heart rate are working together at the same time. Because every time you breathe in, you're in sympathetic, you're in fight or flight, and every time you exhale, you're in parasympathetic.
Yeah.
So it's like just like working with those systems and working with your heart, is very beneficial. Doing those long breath holds when I was doing Wim Hof, I mean, at least it taught me for sure like what calming felt like. Because once you're in that long breath hold, and now having a better understanding of the biomechanics and biochemical things that are going on, like I can understand it and visualize that, I can hold my breath longer because I just off-gassed all my CO2. And if I do 6 rounds of that, I'm going to be calm, because you can put yourself into a very relaxed state of just being in that space, holding your breath. It forces a pause.
Yeah.
And that was hugely beneficial for me at the time when I was getting into it. But there are so many other styles out there. I mean, from pranayama, one of the most ancient ones, to just the paced breathing. But what it comes down to is, most of it comes down to paced breathing. Across the board, no matter what you're doing, it's the most accessible, but it also has the most long-term health benefits associated with it, bar none.
Yeah.
I mean, it's when people are doing mantras, turns out 5.5 seconds, 5.5 seconds.
Interesting.
When people are doing, and I don't know the name of the prayers because I'm not Catholic, but the traditional...
The rosary.
Yeah, with the rosary or the mandala, like same number of beads
82,
as a mala.
Yep.
Isn't
that interesting?
That they're at that same pace of 5 to 6 breaths per minute.
I love when we find out that different religions and spiritual practices all have the same foundational components to them.
Yeah.
And we've found that certain numbers, certain flows of things are very beneficial for our body.
Yeah.
And that's why I don't dismiss religion, because again, if it's giving you the structure, and one of my colleagues and I, we talked about psychedelics in a previous episode, he talked about having religion as a structure to base our life on, and it can be spirituality, but something, you take the good, bad, and ugly of that thing and you learn to work within that structure to make yourself be, to give yourself some structure.
Right, well, and meaning, like Viktor Frankl, Man's Search for Meaning, just like getting to that point, so.
Yeah. So, okay, we've talked about a lot of really good stuff here. I think there's one more thing I'd like to share, and that is an app.
Yeah.
It's a free app. It's called Breath plus, like the plus symbol. Free app to download, really simple to use. It's what I use with my patients for paced breathing. My perfectionists, I recommend that you listen to the sound as opposed to watching the visual. Yeah. So if you have that tendency to be like, oh my God, I'm not catching it right, like give yourself a few breaths to catch into the flow of it, but listen. You can turn up the sound and it makes kind of like a little whooshing up and a whooshing down sound. You can have holds, pauses. You can say, I want 5 breaths in, 5 breaths out. Like it's really functional to use. Do you have any tools like that you like to use with your clients?
Yeah, actually, I use the iBreath app for monitoring that. I've been doing that since you got me into paced breathing a long time ago. But also the Oxygen Advantage app. Like if you're self-motivated and and your clients are like, they're like ready to go with it, they're gung-ho, it's free forever. There's, I mean, it basically does the work of a breath coach in a lot of ways. Seriously, like, I mean, it breaks your exercise down for you 5 days a week. It teaches you what your BOLT score is, which is your CO2 tolerance test. There's so many exercises in there that they've put in there. It's all free forever.
I love
and so
that
people
so
who are
much.
motivated can just get in there. If they have questions, they can email the people on the app. I mean, it really, like, that's the one that I check in with every day, and I'm just like, okay, like, tell me what I need to do today to raise my CO2 tolerance, or just being mindful of my breath work. But I definitely, for my more experienced students who come more often, like, that's when I tell them, like, you can get an iPhone or Android, and it's really pretty easy to navigate. I feel like
the fact that it's free for life and you have everything you need
in order
to
spam
improve
you at all.
That is like, these people know that there's so much goodness in that they don't care. They just want to help people.
Yeah, like, look, just we don't give a fuck what you do. Just breathe.
Do this because
and here.
Everything in your life is going to be better.
Yeah.
So that speaks volumes to the profoundness of this work that still people are not going to value, and that's okay.
Yeah, that's fine.
So we're going to wrap up here, and we talked a lot about basics of breathing, and I'll just quickly go over them. The nose has a lot of important, valuable characteristics, and we need to be breathing in and out through our nose as much as we possibly can.
Especially during sleep, when we're unconscious.
Yep, definitely.
Not knowing what we're doing.
We need to be using our diaphragm when we're breathing, and especially those side body aspects. We need to make sure we're having good posture and that our breath is silent when it's going in and out of our body. We talked about a few different types of breath work, although we could probably spend hours, days talking about the variety. Like, we did not cover exhaustively the types of breath work. We talked about a couple different ones, and it's in paced breathing, Buteyko method, Wim Hof, and holotropic are the main ones we discussed. And we talked about conditions like COPD, emphysema, asthma, hiatal hernias. We didn't really talk too much about low back pain, although hopefully people can kind of piece things together from what we discussed as to why that. You're strengthening a muscle. I have a few books that Derek recommended. I'll put in the show notes. Anything that you'd like to add?
Yeah, I mean, if you read the books and you're interested, find a coach. There's a few out here on the Western Slope or wherever you are. You can definitely check those out. But developing, like, the key thing is, like, anybody can steal 5 minutes away.
100%.
And you can call it meditation, you can call it breathing, you can call it whatever the hell you want to, but steal 5 minutes at least twice a day if you can, one in the morning and one at night.
That's how I start my patients.
To just
5
sit,
minutes.
do some habit stacking. I feed my cats and then I go in and I breathe. 5 minutes minimum. It just changes the way the day comes at you. Yeah. When you just pause as early as you can in the day and take 5 minutes to do nothing but sit and breathe.
Which you are then doing something. So for those of you that feel guilty, you are doing
something. If you count if you lose your way.
Right.
But doing that shorter inhale, like a 4-second inhale, 8-second exhale.
Yeah.
Double the length. Calm yourself down. Let's all just take a minute. And remember that a deep breath is not a big full breath. It's a breath down into the lower belly, and it's just
so
long and slow.
You feel that diaphragm like actually moving and decompressing as the lungs fill. Fantastic. Well, this has been an awesome conversation to have with you, Derek. Love talking about breath work, really reminding me the importance of this and the value that it really brings. Even though it seems insignificant, it's the most profound. So my next guest is going to be, my next guest will not be, I will be talking about birth control because birth control is very important that we understand. Where can people find you, Derek, if they're interested in looking for you?
I'm on Instagram at Blue Raven Wellness. I'm also, they can search my name on
Okay.
Instagram as well, or on Facebook is fine too. And then if you're here on the Western Slope or near Hotchkiss, I'm at the Yoga Tree. I offer 4 classes there. And after May 3rd or so, definitely into June, I'll be offering private sessions with people if they want to work one-on-one with me.
Fantastic. Yeah, it's always a pleasure. I learned so much doing these podcasts. I really enjoy making content for you guys. So if you enjoy it as much as I do, please like and subscribe. Share this episode with someone that could really benefit, especially someone that maybe has anxiety or whatnot. So thank you so much for joining us today.